The title of our session is Using Omega-3 Blood Testing to Increase EPA and DHA Intakes. So for the next 20 minutes, I'm going to discuss Know Your Number campaigns that have been very effective in terms of changing clinical practice guidelines and affecting public health. And so the purpose of these Know Your Numbers campaigns is to have the healthcare community, targeted population groups, and the population at large take action for health benefits that reduce risk and incidence of various diseases. Let's see. So, Bill, which one does that? That one. Okay. So, today I'm going to talk about several campaigns that have been very effective. National Cholesterol Education Program, the Diabetes Education Program, and then a new program that NHLBI, National Heart, Lung, and Blood Institute, has about Know Your BMI. And then I'm just going to set the stage for Bill. He's going to talk about using blood levels of omega-3 fatty acids to get people to eat more EPA and DHA, but there are health professionals that are calling out for us to have people know their numbers of this important biomarker for risk. So there are a lot of Know Your Number campaigns out there, and here's just a little example of some of them. You can see that they target blood pressure, blood cholesterol levels, lipids and lipoproteins, and BMI. And then in addition to telling people that they should know their numbers for these important clinical criteria, they also give them a target to achieve. Dr. Oz is a real popular physician in the media in the United States. He's cited a lot in the popular press, and he's on real popular shows like Oprah, so that he tells the public that they should know these 5 of their numbers: blood pressure, waist size, weight, cholesterol, and fasting blood sugar. The American Heart Association has told people to know similar numbers for their blood pressure, cholesterol, lipid and lipoprotein levels, and blood glucose. So people are hearing a lot about knowing their numbers for many criteria that we need to target to reduce risk for heart disease. So now I'm going to talk about a very successful program, the National Cholesterol Education Program, and they have issued 3 adult treatment panel guidelines, 1, 2, 3, and ATP4 is currently in progress. And we should be hearing about this. People are saying perhaps sometime this coming summer, the summer of 2011. What we know from NCEP 1, 2, and 3 is that NCEP 1, or ATP1, was published in 1988. It had a primary prevention focus, and the primary target was LDL cholesterol. For ATP2, it was published 5 years later. It affirmed the approach outlined in ATP1, but it also issued a more restrictive LDL goal for patients with established coronary artery disease. And NCEP 3 is what we're using now, published 8 years after NCEP or ATP2, and this focuses on multiple risk factors. So in addition to these 3 treatment panel reports, a number of other panel reports were also issued. Recommendations for improving cholesterol measurement and lipoprotein measurement. There are population strategies for blood cholesterol reduction, a report issued for that, and then a report issued for dealing with children and blood cholesterol levels. So what do we see in terms of further actions now that have followed ATP3? A couple of important things on this slide. And let me see if I can, let's see, is the pointer in the middle? Okay. Well, what we see here is that we have ATP1, ATP2, ATP3, and then an updated ATP3 report, which came out in 2004, and then 2 years later, an American Heart Association and American College of Cardiology report, which came out in 2006. And the important thing to note here is that all of these reports are based on a large evidence base, many studies which support the recommendations. And what do we see with these recommendations? Well, if you look at the bottom of the slide, what we're seeing is increasing aggressiveness of cholesterol recommendations, so that in ATP 1 and 2, a desirable or optimum LDL was less than 130, but in ATP 3, it's less than 100. And then in ATP 3, near optimal is 100 to 129. And then in ATP 3, we have a very high-risk category, and that is an LDL that's greater than or equal to 190 milligrams per deciliter. And so in summary then, in terms of where we are right now is, basically intensive LDL cholesterol goals for very high-risk patients. And so interestingly, for the ATP3 update in 2004, an LDL of less than 100 milligrams per deciliter is recommended for patients with coronary heart disease or at risk for coronary heart disease, and an LDL of less than 70 is a therapeutic option for high-risk patients. 2 years later, we see, similar recommendations for patients with coronary heart disease, but this less than 70 milligrams is a reasonable goal for all patients with coronary heart disease. And then a little asterisk in yellow font, if that goal can't be achieved, less than 70, the goal should be we want to cut LDL by 50%. And this is, again, all of these recommendations are based on a large evidence base where we see, lowering LDL cholesterol for secondary prevention, lowering LDL for primary prevention decreases events. And so this is sort of the signature mark of the updated report that came out in 2004, and that is we want to get that LDL as low as possible. And it's going to be interesting to see what ATP4 says, because we have current evidence showing that if we could even get LDL down to less than 50, you continue to have a decrease in event rate. So as a result of all of these recommendations, there are all sorts of education materials that have come out. And here is just one example of education materials from National Heart, Lung, and Blood Institute for individuals who want to prevent heart disease, for individuals who have heart disease. And then the American Heart Association has chimed in with their campaign, the cholesterol lowdown. At the bottom of the slide here, you see the GOED campaign for women, and then the Heart Check program, which helps people choose foods that American Heart Association says are okay to eat. And then at the far right and at the bottom, you see the control cholesterol recommendation, which is a part of their brand new 2020 campaign intended to reduce heart disease by 20% by the year 2020. So what has all of this led to? Well, interestingly, we see that LDL cholesterol has decreased since 1999 to 2005 to 2006. It's gone from 126 to 115 milligrams per deciliter. And in addition, you can see here that the prevalence of high LDL has actually decreased by about 1/3 between 1999 and 2000 to 2000 to 2006. So this has been a very effective campaign. The goal has been decrease LDL cholesterol, and you can see it has done that. And you can also see here that total cholesterol has decreased over the years as well since National Cholesterol Education Program, and we are achieving the Healthy People Guidelines, which is the total population should have an average total cholesterol of 200 or less than that. So again, a very, very effective campaign that has achieved its intended purpose. And what else has happened? Well, you can see what's happened with deaths in terms of coronary events, starting from the year 1900 up to 2007. And then you can see in about 1980 or so, before that time, there's just been a steady increase. And then in 1980, we started to see a decrease in coronary deaths. And then you can see that in 1988, with the launch of National Cholesterol Education Program, there's been a continued decrease. Now, a lot's happened during that time. Omega-3 fatty acids have come into the picture. Intervention cardiology has really been booming. So it's not just lowering LDL cholesterol, but nonetheless, this probably is one contributing factor that's resulting in decrease in coronary deaths in more recent years. So now, let's turn our attention to another successful program, the diabetes program, two diabetes programs that come from the National Diabetes Education Program. And they've launched a comprehensive program for people to control their diabetes, control their blood glucose levels, as measured by hemoglobin A1C, control their blood pressure, control their cholesterol, and then another program which is targeted at people who with prediabetes to prevent them from actually getting diabetes. So these are the two programs, the one, Control Your Diabetes for Life, and it's based on the landmark Diabetes Control and Complications trial, which basically shows that if people control their A1C levels, if they control their blood pressure, and if they control their cholesterol levels, they're going to be better off in terms of their diabetes and the risk for all these terrible comorbidities. And then there's the other program, the Small Steps, Big Rewards, to decrease the incidence of diabetes in people who have prediabetes. So I want to focus on the Control Your Diabetes for Life program. First of all, the National Diabetes Education Program was launched in 1997, and it was launched because of the growing prevalence of obesity and also the growing epidemic of diabetes. And so what are some of the results of the diabetes control program? And what we see is that you can see from 1998 to 2004, there's been a doubling of the number of people who are aware of hemoglobin A1C levels. So awareness has increased. Percent of people with diabetes who check their blood glucose levels one or more times a day has increased from about 40% to 60% between 1997 and 2006. And I have another slide that illustrates this better. So let me show that one in just a minute. But basically, researchers have found between 1999 and 2004 that the average A1C levels were decreasing between 1999 and 2004. So some very, very positive results from this program. And you can see that the percentage of people with A1C levels below 7% rose from 36.9% to 56.8%, while the proportion of people with A1C levels that were high decreased during that period of time. So a big success of this Know Your Numbers campaign. And in terms of glycemic control, what we see here is a shift in this diagram here. And we see that there are fewer people who have high hemoglobin A1C in later years, and more people with lower A1C levels in more recent years as a result of this program. And so this is what I wanted to show you here. We need to still work on A1C levels and blood pressure levels, but there really has been a benefit of this awareness campaign on LDL cholesterol levels. And we see that in between 1999 and 2002, more people are at goal between before compared to before. So there have been some benefits of this program, at least for LDL cholesterol. Okay, in terms of Know Your BMI campaign, what we see in the United States is an increasing prevalence of overweight and obesity in men and women, and between 1960 and 1962, only 10 to 11% of the men in the United States were obese, about 15%, 15 to 16% of the women were obese, compared to 2003 to 2006, where over 30% of males and females are overweight and obese. And we see that in the United States, more and more states have greater than 30% of the population, shown in sort of the orange-brown color, with an obese population. And if you look at these maps, starting way back in the 1990s, there were no states that had greater than 30% of the population that were obese. And I think that the numbers ended at around 20%. So looking at these maps over the years has been very, very alarming, because the prevalence of obesity is just really increasing. And so National Heart, Lung, and Blood Institute and other organizations as well are telling people you should know what your BMI is. And so there's an obesity education initiative. There are a lot of online programs. There are programs that people can use on their PDAs where they can calculate their BMI, and they can find out what their BMI tells them about their weight status, and then there are further actions that they can follow to deal with problems with their BMI. So I don't have any information here about the effectiveness of this campaign. I think we need to just basically stay tuned and see what happens. So people are being told to know their numbers, and okay, pardon? The pointer should work in the middle. It's not working. Oh, okay, it's working here. Well, basically for glucose, cholesterol, blood pressure, BMI, among others, they need to know what that goal level is, and I think what we're doing now is telling them why this is important. So in summary, there are a lot of Know Your Number campaigns out there, and there are some that have been very successful, like Know Your Cholesterol Level, Know Your Hemoglobin A1C levels, and they are having an impact on chronic disease and major chronic diseases that at least the United States is experiencing. So knowing your number will be key for public health messages. And this is my last slide before I turn it over to Bill. What about omega-3 fatty acids? That's what we're all here for. So Bernadine Healy, the former director of NIH, issued a commentary in a U.S. News and World Report in August of 2008. And what she says is there's no nutrient that's more important for decreasing cardiovascular death and more lacking than omega-3s. And so I want to read just a couple of sentences. This is no fish story. Raising omega-3s could be as important to public health as lowering cholesterol. And she talks about the National Cholesterol Education Program. It has been resoundingly successful. And what she says is the National Cholesterol Education Program even launched a Know Your Number campaign. But who knows their levels of omega-3 fatty acids? Before long, your personal omega-3 index just could be the new cholesterol, the number you'll want to brag about. So I'm going to turn it over to Bill now.